All right, so today I'm going to introduce you about a laser-based imaging system for early caries detection. So when it comes to dental caries, when it comes to the early stage dental caries, currently it mostly rely on the wait and see strategy. So basically, due to the lacking of the device that can detect the caries at the early stage, when it use the video examinations or X-rays to find those caries, typically filling of the teeth is required. So as a result, the further development of the caries, like the later stage treatment for the bridge crown or even lose of the teeth may happen. Now, the good thing about the caries is, if we can find them at the early stage, it is possible to treat them with non-invasive methods. So the advanced treatment may be avoided. But at this stage, the technologies used to detect that is still lacking, is not satisfactory in the clinical settings. So we proposed the using the laser to get the Raman images from the teeth. Now, the Raman imaging is an inelastic scattering. So that way, it will be able to get the caries at the early detection, early stage. So one key modifications they're comparing to the typical imaging system is in our setup, we send the laser. Send the laser through this dichroic mirror, and which did not go through the objective when it reaches the sample. Now this gives advantage that now we can modify the laser profile because you don't go through the objective, then the laser is not converged. Now we can modify the profile so the beam can cover the whole field of view of the sample and of the lens. Now that way, it gives us advantage that we can modify the profile, and the second, because it's cover the field of view and it's a bigger area, like up to 1 centimeter in diameter. Now then we can sense the loss of power, like for example, 2 watts. And this way, the bigger power, illuminated the whole area, it will compensate for the weak response of the Raman scattering effect. And that way, it will make the time scale feasible in the clinical scale, in the clinical settings. So as a result, I just put all of them here. Now I show 2 typical results from 2 kind of teeth. Now, first of them, they have a white lesion there. That's like a typical lesion that you can see with the eyes. And at this, for this, you typically need a feeling of it. The advantage of this device is, in addition to the capability to detect those that can be seen by the eyes, it can also show the changes of the mineral concentrations to the teeth that appears normal to visual examination or like the standard cameras. And this way it will show there's some loss of this. Those can be categorized to the early stage caries. Okay. And it may also show some of the loss at those tips that on the tip of the molar teeth. So this is the first roadblock, preventing the Raman imaging to clinical settings or caries detection. Then after this, we're working on now to the previous images were taken by the system that on the optical table, and the next stage is to bring the device to patients. So what we propose to do is, first approach we're going to do is using a fiber-based probe. It'll be something like that, and then you hold it and then bring it close like the toothbrush shape. In that case, the one fiber bring the laser, the other fiber take the picture and send it to the high sensitive camera. Now, the other approach, in case that one doesn't go as well, then we will propose another approach where the fibers is not used, and you can set up a stage like that and bring the patient put the chin on the table of the stage. Then we can have a probe that is moving on the track, and then can bring it close to the mouth to do for the same purpose. So that's the idea for the next step. Now, if any one of these two approach is going to work, then we're pretty much very successful to a good device. And when we bring it to like a next stage, like clinical trials. So that's the yeah, that's like the plan. So that's all I have for this presentation. Now, any questions?
Questions, anyone?
So can you grade the different types of lesions, or is it just binary that there's a lesion there or not?
I think we can. So at this stage, we haven't go to that details, but the technology itself, it has a potential to distinguish the degrees of the decay of the mineral loss. So we can quantitatively, measure it. And actually, at this stage, we also need to determine now at what stage of the loss of the mineral it can be characterized as the where the non-invasive treatment it will be effective. When it passing certain levels, then it may not as effective at all. But that's something definitely can be characterized by the device, because we're measured based on the concentration of the mineral.
Other questions? Anyone from Allison's side?
All right. What? It's time for lunch, I guess.
One more question. So how
Okay.
much do you think this would cost to?
Make it?
Yeah.
Well, that's at this stage is actually the prototype that I built in the lab is cost probably around $50,000.
Okay.
Because you need a good CCDs to measure the weak response of the Raman signals. When it comes to like volume production, then I don't know, probably we can bring it down to 10,000. And it's not like some small things you can make it like a $2,000. Probably that's not going to happen in the near future.
Thank you. Any other questions? All right, thank you very much.
All right, thank you.